Hey guys, it's Sarah here. In this video, I'm going to be going over questions that you're going to be asked in a nursing interview and how to answer them. So let's get started. So number one, they're always going to start off with the famous, tell me about yourself. And when they say tell me about yourself, they really are looking at your mannerisms, they're looking at your attitude, your personality. They're basically getting a first impression of you. So you're going to be doing the talking and they're just going to be listening to you getting a first impression. But what you're supposed to answer is, you're supposed to answer of how your whole nursing journey came about. So for instance, they'll say, tell me about yourself. And you'll say, okay, so my mom was a nurse and I always wanted to be a nurse. So when I graduated high school, I went to 4-year college, I got my BSN, and then you continue like that. And you tell them like your whole nursing journey. Or if your mom wasn't a nurse, you could say, I always wanted to become a nurse. So I became a medical receptionist to get some medical knowledge, and then you continue. Then I decided to go into nursing school. I did 4 years and then I graduated and now I'm looking for a job. So it's basically your nursing journey. Whether you have experience, whether you don't, you basically say that. So then everyone is gonna have a resume in front of them. So whether you give them a resume or they have your resume because you emailed or you applied online, they're gonna have your resume in front of them. So they're gonna ask questions based on your resume. So everyone's is different. So let's say your resume said that you were CNA. So they're gonna say, tell me about that. And they're gonna say, what did you do? So you wanna say the most stuff that is medical. So if you were a medical receptionist, say, oh, I got familiar with medical terminology. If you were a CNA, you say, I help patients, all the medical knowledge that you did. If you don't have any, then just talk about your experience in school. When they talk about your BSN, say, oh, I did clinicals here, I got experience there, I had a 4-year college, and you go on that way. But that's basically the next step after they ask, tell me about yourself, is that they're looking at your resume. After that, then they're gonna ask you the generic questions that they ask in every interview. So the first one is gonna be, tell me your strengths and your weaknesses. So your strengths, you could go on and on. You could say, I'm on time. You could say, I'm a team player. They wanna hear that. You could say, you're caring, compassionate, all those words. But your weakness, you only really wanna list one, because you have to list one. You can't say I don't have one, because everyone has, and obviously they want an answer. So you have to list one. So if you're a new grad, that's what I always said when I was a new grad. I always said, I'm a new grad, so I don't have much experience, and that's my weakness. Because that's expected, but it is a weakness, so that's a good one for a new grad. If you're not a new grad, say something that has nothing to do with you. For instance, I don't have much experience, or I don't know how to do this, something like that, something that they could teach you and that has nothing to do with you. Because they're not going to change your personality, they're not going to change your attitude, they're not going to do all that, but they could teach you. Then they're going to ask you about conflict. If you had experience, they're going to ask you if you ever got a fight with a coworker or a patient. If you don't have experience, they might ask you a scenario. So the answer is always talk to the person first, and then if that doesn't work, you could escalate it to a manager. So if they ask you, you ever have a scenario where you got in a fight with someone, or you had a conflict with someone or a patient, so you always want to say, I try, and you talk to the patient or talk to the coworker first, try to work it out. And if that doesn't work, then you could escalate it and bring it to your manager. Then they're going to ask you a time when you went above and beyond. So this is something I would think about prior and know what to answer, because it's not like it's going to come like that if they're going to ask you on the spot. So a time you went above and beyond could be in nursing school, could be as a nurse. Sometimes you spend time with the patient, you took time out, you were really busy, you decided to get the patient, something that made a difference to them, or whether it was to go upstairs to get them a warm blanket, or to update them on the labs, or to just something that made a big difference in their life. And of course, they're not going to ask you, they're not going to really test your medical knowledge, but they are going to ask you some basic scenarios. So your basic scenarios are usually prioritization or delegation. For instance, they're going to say you have A is someone coding, B, it's not going to be this obvious, but A is going to be someone who is going to be their ABCs. B is going to be someone who just keeps bothering you because their mother needs to be turned. C is going to be someone who needs something but not that urgent. So what they're asking you is to basically, they want to see that you're going to do the ABCs before anything else. So if someone breathing, airway, circulation, all that, that's always going to come first. So it's pretty easy. You just have to listen. The person with chest pain always goes first. The shortness of breath, palpitations always goes first. Then they might ask you a scenario with someone. You're really busy. You have 5 patients. Which patient do you see and delegate? So you always want to delegate as much as you could. You could delegate on a chronic patient and something that is stable. And last but not least, one question they love to ask is, how are you going to deal with difficult patient? Number one, you remain calm. Number 2 is that you try to help them. So for instance, most of the time, difficult patients are usually because they want something now. Everything's an emergency. Their mother needs to be seen right now. Where's the doctor? Where's the nurse? So in those type of situations, you could just say that you always help them and you update them. So for instance, you don't lie to them. You don't tell them the labs are gonna be ready in 10 minutes. You tell them it usually takes around an hour. You keep giving them updates. Oh, the results are not back. Oh, the doctor's seeing someone else. He'll be in right after. And you be truthful and you keep updating them and you remain calm. And that's pretty much it. So that's pretty much the questions and answers for a nursing interview. It might not be the same exact questions, same exact answers, but pretty much those are the questions that are asked in every interview. Now, always remember to just memorize your resume, know what you write there, and know how to answer any question that may arise from your resume. Like, what did you do here? What did you learn here? Etc. And just remember, those few questions that I went through, just know how to answer them in case they do arise, because they are asked quite commonly. And after all, if you didn't get the job, then it wasn't for you. The job that you want will come, whether it's after a year of you doing something you don't, and then you get into the field, but your job will come. So good luck on your interview, and I hope you ace it. Bye.